Dr. Tang, what is your perspective on the best ways that physicians can help empower patients to meet their goals?
Well, I think the best way to help for physicians to help patients is to really understand what patients' health goals are. And oftentimes they don't center around diseases at all. Even someone with diabetes, which is a very ravaging disease, doesn't focus on the diabetes or doesn't focus on the sugar. They focus on what's meaningful for them. It could be, in one case, we even asked patients about this. One person said, I want to be healthy enough to donate a kidney to my niece who's in kidney failure. Another person said, I want to live to 90. Another person says, I want to live to see my daughter get married. People have these goals in mind. If we attach to those goals, I think we have a much better chance of aligning in terms of shared decision making around their health conditions. So I think we need to know more about them as individuals rather than them as just diseases.
And how do you suggest physicians go about finding out exactly what those goals are?
How about asking them?
Good place to start.
So we, in our intake, in our history and physical, we ask the history of their diagnoses, history of their past, their surgeries, and we call it a social history, but we don't really find out about them. If we knew about them, what meant a lot, what gives them meaning, what are their life goals, we'll have a better entree in terms of working out together how does what we do from a health care point of view intersect with your life goals. I think we'll get a lot more accomplished that way.
And how did you come to the realization that the patient goals are really where we should be focusing on?
So we looked at, there was actually a study, a project that was done at Lucille Packard with looking at children with very serious chronic diseases. And they asked them, what would you like your doctor to know that your doctor doesn't already know? And they talked all about their life, and they didn't talk at all about the disease. So we actually took, I was so impressed by that, we took that same method and asked adult people with diabetes, in this case, what would you like your doctor to know? And some of the questions I just, some of the answers I gave to you were gotten from that method. What would you like your doctor to know? It's pretty simple. And they come up with it very easily. We just never asked them that question.
So you would really like to urge all of the physicians out there to start asking that question and really delving into what their patients want.
Exactly right. Out of life, not out of their disease.
Right, right.
And I think we'll sync up.
And what have you thought of MedX so far?
It's very interesting, and a lot because we've had all these patient testimonials, and the underlying theme is really patients not being treated as people, not being treated as individuals, and I think that causes the disconnect and the less effectiveness of how we can help them with their health. So that's been very helpful. It's just to hear from patients and their experiences. And it sounds like we have an audience that's very interested in that as well.